Community Viewpoint with John Pollock and Maria Hurst.
And welcome once again to Community Viewpoint. Once again, I'm your host, John Pollock. Today we have the honor of having our new general surgeon for Desert View Hospital with us. He's sitting next to me, John Sorensen, and next to him is Kelly Adams, the CEO of Desert View Hospital. This is my first time meeting both you gentlemen, and it's a pleasure to meet you.
It's good to be here. Thank you.
Yeah, and thanks for coming by. You found Pahrump, and you're in the reserves.
I am. Pahrump and I found each other.
Okay. So my question is, like, they asked me, why Pahrump?
Sure. And a lot of my friends have asked me the same question. I came back from Afghanistan about 6 months ago. It was my fourth deployment, and usually when I come back from a deployment, I reassess my life, and I did so this time as well. Mm-hmm. And looked around, saw what I was doing, and tried to consider what I really wanted to do with my time going forward, and decided I wanted to spend it in a smaller town and just connect with the community and just take care of people. And so I began looking around, and it didn't take long before Pahrump and I met. Actually, Kelly here gave me a call.
Right. So you were in the market for a chief surgeon?
Yeah, as we kind of looked at the hospital and looked at the needs of the community, it became very evident in my short time here in Pahrump that we wanted to recruit some primary care-based physicians, including a surgeon. And so it was a timing more than anything that I started looking at the same time Dr. Sorensen started looking. And we both kind of found each other. It's an amazing story how it all kind of came together at the same time. Oh. That this community attracted such a world-class surgeon as Dr. Sorensen.
You've done trauma. You've done a lot of battlefield things out there while you're in Afghanistan.
I have. I've done trauma in my civilian career as well as my military career in the past. Focused also on organ transplantation, liver and kidney transplantation, and general surgery, complex liver surgery, and cancer surgery, things like that.
Really? Mm-hmm. So that's not normal anymore, that you find a surgeon that does all these things?
No, it's probably not entirely normal, but I'm not an entirely normal person.
Well, welcome to Pahrump. Totally not a normal town, but that's excellent. And have you operated yet here?
Did last couple of days we've done a few cases, some good operations. So far so good.
So this is going to keep us from having ourselves transported to Las Vegas. There's a thing they call the golden hour, to have the care given as quick as possible, especially if it's traumatic too. Get the work done here, rather than going either by flight for life, which puts us in the poorhouse sometimes, one flight, or being transported by our crack medical team here.
Yeah, no, you're exactly right. As the assessment of the community, we saw the out-migration, we saw the expense that you're talking about here for air transport and otherwise. There's not a week that goes by that someone from the community doesn't talk to me about, please, our wait times are too long to get in to see a physician. Mm-hmm. We are tired of going to Las Vegas for health care, for even simple things. Please, bring some more primary care and surgeons to town. Mm-hmm. So, we're answering those needs early on here.
I was lucky when I had just a small operation that it wasn't life-threatening. So the doctor, my personal doctor, had a referral, and I was operated on here too, and which is a lot more comfortable than driving back and forth and going out there. So I was glad we had the facility then. But then you can do ruptures too, because it's head to toe. That's part of what you can do.
I will do that.
Yes, all right. The next time I'll look you up. Hopefully there won't be a next time.
Yeah.
As I get older, I should be a little bit smarter and quit doing that.
Well, that's that deal. Nobody wants to use the hospital, but it's good to know if you need it, you have quality care that's available.
Right, and then you came on staff, I believe, the beginning of June?
That's
was it?
correct. Started in June and started seeing patients, and it's just growing gradually from there.
Mm-hmm. And you're living here?
I am. I have a home here, and my wife and I enjoy it. We like the community. We like the desert environment. We've really enjoyed it. I think more than we thought we would.
Excellent. That's great to hear. I noticed the article in the Pahrump Valley Times that Selwyn had written that you want to get into with the community spirit and also help the veterans because you're a veteran too. And you mentioned that you understand there's a great veteran population here too. As a matter of fact, the DAV has their little like welcome station in front of the in the front.
Yeah, they're in the front lobby there every Tuesday, Wednesday.
Which is really great, and it's a wonderful service that it's provided for our veterans there. And the guys out there said they had met you out there because, you were talking to one of the patients' loved ones too, so they've connected with you already.
I do have a soft spot in my heart for the vets. I've spent enough time serving with those, the people, and feel like they're some of the best people in the world. They're some of the best people I've ever met, or I've met while overseas, or even here in this country, wearing the uniform.
So you had how many tours of duty over there since 2001?
Well, 4 altogether, 2 in Afghanistan, 1 in Iraq, and 1 in Bosnia.
They don't last a year, do they?
No, for me they're a little shorter.
Okay, good.
6 months, 4 months.
Okay,
like
but
that.
still, it's quite a long time. So, TBI, PTSD.
All those things, certainly lately, those have been recognized as being very important, and especially the rest of the veteran's life. It impacts everything they do, their personal relationships, their health, their ability to work, all of those things.
Right. That'd be great if, you can meet the veterans and speak to us, and because I believe they probably could connect with you because you've been there.
I look forward to it.
Yeah,
I do, and I've met a number of them already, and look forward to meeting more.
So this is here and now. What do we have to look forward to in the future? The doctor is going to be. Do you see patients at the hospital? Do you have an office there?
My office is right in the same parking lot as the hospital. It's a separate little building, but it's adjacent to the hospital.
Okay. So what are we looking for in the future?
Well, I think you have a lot to look forward to in the future here. Desert View Hospital is a terrific base to grow from. And although we have smaller structures, we plan on putting a larger medical office building on campus to house a number of other physicians. I kind of use the phrase going through the heavy lifting right now, and that's really what it is in terms of bringing more primary care, PCPs as I call them, primary care physicians to the community. We're several physicians short, and I think the community can look forward to that, be it internal medicine or family practice, eventually getting into more OB/GYN, ENT, those types of things. And so, but I need to get the PCPs into place first. And so with that, will allow the hospital to offer greater services to the community.
That's great. I know we used to have an area for a maternity ward. We lost that. Maybe sometime in the future.
I think a community now of 40,000. The hospital really needs to be providing more services for a community that size. I look at other communities around the country, and I look at the hospital divided by the population base, and that's what I do. I look at those things. I understand the demographics, understand the epidemiology, and what kind of physicians we need to bring to answer those needs of the community. And so that's my area of expertise, is to look at communities like Pahrump, to look at hospitals like Desert View, and how can we improve the healthcare delivery system in the entire valley. So that's what I'm about over the next several years.
And then you get feedback from the community too, positive feedback, hopefully.
Yeah, well, again, right now, there's such a need, you know, and as I'd mentioned, there's not a week goes by that I don't get a request from someone from the community that, please, help us out. And so I welcome the invitation to get in front as many clubs and groups and organizations as possible.
Well, I can help you with that.
Well, I would, you know, I've been with the Rotaries and
Excellent.
as with the Nye County Coalition, and
Okay, good.
you know, I'm looking for more opportunities to talk about where we're going and to get feedback from the community.
You know, what Kelly's talking about, I think, is very important, and there are a lot of hospitals across the country that are focused right now on survival. And when I came here and spoke with Kelly for the first time, he was able to articulate a larger vision of what's going to happen in the future and the progress and the development and the building of a real healthcare system here. And that attracted me a lot. So he's the vision guy, and he's good at it.
Well, thank you. I appreciate you saying that. You know, well, you know, dinner somewhere in the future, I'm sure, for those nice comments. Thank you. Appreciate that. You know, but
I'll take whatever I can get.
all hospitals, John, all hospitals are faced with unbelievable challenges today. You know, we're all too aware of healthcare reform. You know, we're all too aware of the need for healthcare, and you know, as the cost of supplies, everything go up, you know, the reimbursements to hospitals and physicians are going down. And so there is a true economic scissor happening, you know, in the healthcare arena today. So, you know, we have to, no pun intended, but we have to surgically look at what we can keep and what we can add to this hospital. And fortunately, the very things that Dr. Sorensen spoke about right here is that fortunately, you know, we can overcome a lot of those downturns in the healthcare economics because we're on a growth path. That will answer a lot of those downturn needs.
Yeah, you certainly have a large campus over there, so there's a lot of place for growth over there, so I could see a lot of good things coming over there.
Well, we have terrific neighbors that own the property around us. The hospital itself has 25 acres or so, and so I know there's some other growth considerations going on, so it will become the campus of choice for healthcare in not too many weeks or months in the future.
So this is great. This is Dr. Sorensen, our new general surgeon for our hospital here in town. We have you since June 3rd, I believe it is, and you're a local resident now. Kelly Adams, the Chief Executive Officer for Desert View Hospital. And I can say that it was before you got here, and I was serviced by the hospital. I had an operation there, and I had fantastic service, and I'm here. We have, as far as I'm concerned, it's got a very good reputation, and it'll just get better with gentlemen like you and your staff and the other people that I know. And because it's a small community, you know a lot of the people over there, which makes it more of a hometown feel to it too. So we appreciate you coming here, appreciate meeting you. Thank you for spending this time with us, and we'll see you in the next segment. Thank you.
Thank you.